A 43-year-old man presents to the office with complaints of mild abdominal pain, yellowish discoloration of eyes, and itching all over his body for a year. He recently lost 2.4 kgs over a period of 1 month. He says that his urine is dark and stool appears clay-colored. He denies any history of hematemesis, melena, or fever, but mentions about his travel to Europe 6 months ago. Past history includes a coronary angiography of angina chest pain 2 years ago, which shows 75% blockage in the left anterior descending artery. He takes medications on a daily basis but is unable to remember the names. On physical examination, there is palpable non-tender mass inside of the abdomen. The lab results are as follows: ALP is 37, total bilirubin is 80, AST 191, ALT 184, and CA99 is positive. The serology is negative for hepatotropic viruses. Abdominal CT scan with contrast shows multifocal, short segmental stricture of bile duct outside the liver and mild dilation, along with hypertrophy of caudate lobe and atrophy of left lateral and right posterior segments. The biopsy of the bile duct reveals periductal fibrosis with atypical bile duct cells in a desmoplastic stroma. Which of the following predisposing factors is responsible for this condition? A. Long-term carcinogenic effect of contrast agent, chronic infection due to hepatitis virus, idiopathic inflammatory scarring of bile duct, liver fluke-induced inflammation leading to metastatic change, and abnormal cystic dilation after biliary treatment. Here the diagnosis is primary sclerosing cholangitis. What leads you to it? Mainly this. The biopsy of bile duct reveals periductal fibrosis with plastic stroma. See, here the condition given is primary sclerosing cholangitis, obstructive, some of you wrote obstructive jaundice, but main diagnosis over here. Okay, just tell me, recent weight loss of 2.4 kgs and CA99 positive. What does this indicate now? Think again. Forget the rest. Recent weight loss and CA99 positive. What do you think about this? What is this a marker of? Here the diagnosis is cholangiocarcinoma, which is the cancer of biliary epithelium. Okay, that is cholangiocarcinoma. See, anywhere in questions, if they've given a recent weight loss of 2.4 kgs over 1 month, that is a lot. That is a significant weight loss. CA99 is a marker. You must have seen it in pancreatic cancer a lot, but it is also a marker in case of cholangiocarcinoma. It is the second most common liver tumor after hepatocellular carcinoma, right? And it is, like I said, it is a cancer of biliary ducts. Now, if it's a cancer of the smaller bile ducts, it will not lead to a significant symptoms. But if it affects the larger bile ducts, the main draining bile ducts, it will lead to obstructive jaundice. That's why you see dark urine and clay-colored stool, because it causes obstruction. Right? Even sometimes here in there is a palpable non-tender mass. Again, this non-tender mass. This will also lead you towards some cancer, which is usually non-tender. Right? Here, it is cholangiocarcinoma affecting larger bile ducts, which leads to obstructive jaundice and a palpable non-tender mass. The mass is causing the obstruction. Right? Even here, see, atypical bile cells, right? Desmoplastic stroma. Desmoplastic stroma is basically a lot of fibrous tissue. Some cancers have desmoplastic stroma, which is a lot of fibrous tissue, and there are the cells. Atypical cells, this is also one clue. So here, basically, if the patient has primary sclerosing cholangitis, and which has led to cholangiocarcinoma. So obstructive jaundice is correct. It is what is happening here. But why is there an obstructive jaundice? Because of cancer. Obstructive jaundice can occur due to a lot of causes. It can also occur due to gallstones. It can occur due to pancreatic adenocarcinoma. But pancreatic adenocarcinoma, the presentation will be something related to the deficiency of enzymes, right? In pancreatic adenocarcinoma, because of obstruction, the pancreatic enzymes are not able to reach the duodenum. It will lead to fatty diarrhea, steatorrhea, because lipid digestion is and lipid absorption is not occurring. So it will lead to steatorrhea. Pancreatic adenocarcinoma will present as weight loss, CA 99, but they'll mention um even obstructive jaundice, but they'll mention steatorrhea, diarrhea occurring in. Or if it is in the tail of pancreas, they'll mention hyperglycemia. So diabetes, which is diagnosed as an old age, newly diagnosed diabetes, a history of active pancreatitis. All of this will occur in case of pancreatic adenoma, right? But here, because this biopsy of bile duct, which is showing atypical bile duct cells in a stroma, that's why it is a cancer of bile duct epithelium, which is cholangiocarcinoma. Okay. Now let's look at the other option, long-term carcinogenic effect of contrast agent. Now in earlier times, thorotrast was used for in as a contrast agent. Long-term carcinogenic effect. See, here the patient underwent this procedure just 2 years back, right? Chest pain and went coronary angiography and all of that. So 2 years is not a long time for any carcinogen to act. It's usually 15, 20 years back in history if something is there. And thorotrast, which was used earlier in the 1930s and 40s, it is not used anymore these days anyway. So there is no carcinogenic effect due to it. Chronic infection due to hepatitis virus. Now, this is also fairly simple. It shows how important it is to read the entire question stamp correctly. And in cases when there is such a long question stamp, it can be overwhelming. But if you go on highlighting it as you solve, it will be easier. You won't miss important points. Now here, they have given that the hepatotrophic virus is negative for hepatotrophic viruses, right? The serology is negative. So you can try to eliminate that option. Right, chronic infection due to hepatitis virus, that is out. Now, liver fluke induced inflammation leading to metastatic change, plastic change. This is correct. Chinese liver fluke is an infection which will lead to cholangiocarcinoma by its chronic inflammatory effect. So, this organism is a parasite which will reside in the biliary tree and will lead to chronic inflammation, and eventually it will lead to metaplasia and cancer. Dysplasia and cancer. But here the patient has a history of travel to Europe, and this organism is usually seen in the East or Southeast Asia, as it's correctly called the Chinese liver flu. Right? So there is no history of travel to Asia, Taiwan, or any places. So liver fluke is out. It's a wrong answer. And abnormal cystic dilation of biliary tree. Now, what is abnormal cystic dilation of biliary tree? This is a childhood condition occurring wherein there is dilation of the intra or the extrahepatic biliary tree. It is usually a pediatric condition, and it has the similar presentation of jaundice and itching and all of that. And it is usually treated with liver transplant, but it is not a case here. Right? It's a pediatric condition. So correct answer is C, idiopathic inflammatory scarring of bile duct. So this is a case of primary sclerosing cholangitis leading to cholangiocarcinoma.
Thanks for watching. Please give a thumbs up and subscribe for more.